And Chapter 3 reviews the principles of health policy, politics, and reform. Again, I don't have an awful lot to add to the text, but we will review some of the essential components of what is currently being utilized for our policy bodies. So, need to start off with definitions of policies and public health policy. Policies are a set of principles that govern an action to achieve a given outcome or guideline that direct individuals' behavior towards a specific goal. We have these in our acute care settings. We have them in our ambulatory settings. Policies govern or outline specifically what it is that we need to do, and hopefully they will have an outcome associated with each one of our policies. As far as the public health policy is the decisions made in regard to the health of the individual and the community. Again, our main focus with public health is oftentimes groups, the community or populations, but they are comprised of individuals, and in order for us to achieve health outcomes, even though we are looking to improve the health outcomes of a group, is that the individuals, we have specific health outcome goals for each one of the individuals. And again, the health policies contained within public health impact the health of an individual, family, or population and community. So everything is about politics. Everything that we do is about politics, and in order for us to change or to improve or to adjust the health outcomes of our communities, we have to figure out how we can deal with the politics. The politics drive what gets funded and the allocation of those resources, and it's the same within developing budgets within our healthcare, our acute care settings, our ambulatory settings. The same is true for policies as well. So, if you want to impact, here is a particular area that might interest you as far as getting involved in the politics of setting health policies. Access to care and health insurance. As you saw in the text, basically the national system, the United States system, is based on health insurance. So that's how it gets reimbursed, and that's true with not only the independent collaboration of our private health insurances, but also Medicare, which is at the federal level, and Medicaid, which is at the state level. Economics is a study of how individuals, groups, organizations, and society allocate and utilize those resources. If anyone has taken or read about project management courses, they often focus in on and refer to sort of the three-legged stool. The three-legged stool of scope, budget, and schedule, and oftentimes they will then add a fourth leg to that stool, which is resources or people. And all of those need to be, one of all of those need to be adjusted in order for us to shift the way that we are focusing on a variety of health outcomes, the cost benefit. We need to be able to adjust accordingly as well. One of the things is that we hopefully will continue to have a strong role in shaping healthcare policy as far as nurses are concerned. So being involved in healthcare policy setting, implementing that, and reinforcing to our different agencies as to what the priorities should be and what the outcomes should be for that. An issue that all professions really have is diversity within the workforce. You saw and you read in the text the sort of the ethnic background of most of nurses, and I think that applies to all of our workforce, healthcare workforce. in order for us to be culturally sensitive, we also need to take a look at how we can incorporate diversity within our workforce as well. As far as equality in healthcare, in addition to improving and reviewing the diversity of nursing, we also need to consider the equality or the inequality of our current system of insurance. And again, I emphasize that we're not talking about actual care here or the health outcomes. We're talking about what gets reimbursed. And unfortunately, sometimes that we don't have a lot of equality in what gets reimbursed. Certainly with the Affordable Care Act and with President Obama making healthcare a top priority, hopefully we will make sure that at least the healthcare insurance is more affordable and available, and so we improve access to more individuals by making it more affordable, as well as the key component that we talked about in an earlier chapter is the fact that along with the Accountable Care Act is the pre-existing conditions. So hopefully just major access as well as continued access will continue to be part of the Accountable Care Act. Along with the Accountable Care Act is the incentive to increase information management, is to implement health information technology, along with making access to insurance more affordable. The current policies have heavily invested in incentives to invest and implement electronic medical record systems. Certainly, you've heard of the phrase of the meaningful use, so not just to incentivize hospitals and providers to implement electronic medical record systems, but to implement them in a way that is going to have an impact on healthcare delivery and healthcare outcomes. So in order for the providers and hospitals to be able to gain access to these incentived monies, they had to implement it in a way that proved that they were impacting the outcomes. Along with that is ethical considerations. Hopefully, healthcare is closely linked to ethical issues and decisions. It's many discussions about how to make healthcare more affordable, includes the discussions regarding end of life that was outlined in your book, in the text, as well as making sure that that we're not just reimbursing and paying for expensive treatments just because they're new. What are the outcomes of those technologies? What are the health outcomes and the impacts on the things that we do? All those are taken into consideration, hopefully, with our politicians as they discuss health advocacy and healthcare reform. But as we all know, the policies are oftentimes, especially for at the national level and at the state level, are set by political policies, and hopefully we can continue to be involved in that as nurses and impact that. But in order for us to be able to have an impact on health outcomes, not only do we have to be at the table for developing these programs, but also developing the programs and the strategies for each one of these programs. Part of that can be addressed by health services research. Research allows us to hopefully identify what is quality care, what are the health outcomes that we need to address, and how best to implement those, so that hopefully we will then have the proper health information management and insurance for all, and to make sure that we are indeed identifying and implementing equity with and improved access as outlined in the Affordable Care Act.